and we begin on COVID and booster shots. Top health officials say not so fast when it comes to COVID-19 booster shots. They say more time is needed to review the data. The White House is now backing off of its promise that a third dose of COVID boosters would be available starting 2 weeks from today. White House Chief of Staff Ron Klain says at this point he doesn't know when Americans will be able to get them because they're waiting for the green light from the FDA. Dr. Fauci, however, says he's confident that Pfizer is still on track for that September 20th booster rollout. He says Moderna's may be slightly delayed beyond that. All of this comes as COVID cases are surging once again in the United States. The 7-day average of new cases per 100,000 residents is 300% higher than it was on Labor Day of last year. The CDC also says children's hospitals across the country are filling up with COVID cases, and community transmission is dangerously high. We'll have much more on this in a moment. Let's begin, though, with our senior medical correspondent, Elizabeth Cohen. Elizabeth, good morning to you. Why is there such a lack of clarity here on the booster? The way I understand it is the White House is saying we've got them, we bought them, but now we need the green light from the FDA. But they thought they were going to get that by the 20th of September.
Poppy, I just want to sort of cut through all of this and say, you know, I don't usually like using sports metaphors, but I'm going to use one now. This was an unforced error by the Biden administration. Back on August 18th, they said, we'll be ready. President Biden said, we'll be ready by around September 20th to do this booster rollout. They never should have named a specific date. What they should have said back then was, look, in the coming weeks and months, we will have boosters ready. We are planning. We are preparing. It will happen, but we don't have an exact date. Once you give an exact date, as we've seen during this pandemic, things happen. And exact dates, you don't always meet those deadlines. So let's take a look at where we are right now with the U.S. booster rollout. So Fauci has said that Pfizer looks like they'll be ready to go the week of September 20th. So that means if you got your first 2 shots with Pfizer and you're in the right age range and all of the other specifics, it looks like you could get a booster on September 20th. Moderna, Dr. Fauci said, might be behind that by a week or two, and there could be data in a couple of weeks on mixing and matching. In other words, just because you got Moderna the first time, maybe you'll get a booster from Pfizer or vice versa. That is possible. So the bottom line here is that for anyone who is fully vaccinated and enough time has passed, say 5 months, 6 months, 7 months, 8 months, somewhere in there, you could be getting a booster in the coming weeks or months. It will most likely be offered and available to you. It might not be the week of September 20th, but it will happen. Let's take a listen to Dr. Fauci.
Pfizer, one of the companies that has the mRNA, has gotten the information in, has been examined, and things look like they're ready to go. Moderna might be actually a little bit behind that, and if they are, what you might see is rather than the simultaneous rolling out of the booster program of both those products, you may be sequential by about a week or two.
Now, to a great extent, the U.S. is relying on Israel for its Pfizer data. The Pfizer's been pretty much the only game in town in Israel, and they've been keeping very careful track of how people are doing. Let's take a look at their booster rollout. They began their booster rollout July 30th, so quite a while ago. Anyone is eligible at 5 months past their second shot. It doesn't matter how old you are. In a study of people ages 60 plus, it showed that the booster reduced the relative risk of severe illness more than 10 times. Poppy?
Elizabeth, thank you. Obviously following and watching very closely what happens in Israel as more people get these boosters. Meantime, more than half the nation's schools either have part-time nurses or no nurse at all, and the ongoing shortage of school nurses is turning dire as children go back to the classroom and as COVID cases are also rising now among kids. The CDC says hospitalization rates for children have soared this summer as the Delta variant has spread. Let's go to our Jacqueline Howard. She has more on all of this. I mean, it's just making such a difficult, such a troubling situation even harder if you don't have what you need in the schools.
That's right. If you don't have a school nurse, it definitely makes it harder to test for COVID-19, track cases, isolate cases. So school nurses play a role specifically in the COVID-19 mitigation measures, but also in other everyday activities as well, like making sure a student who might have some anxiety on the first day of school feels comfortable. And of course, making sure students who might have food allergies are okay, and so many other things, Poppy. So this shortage has been ongoing here in the United States for years, but now infectious disease experts I've talked to, school nurses I've talked to, they all say that the shortage is becoming dire. And based on data from the year 2018, we can estimate that about 39% of schools nationwide employ a full-time nurse, about 35% employ part-time nurses, but there's still that quarter, about 25% of schools do not have a school nurse at all. And there are some Democratic lawmakers who are hoping to address this. Nevada Congresswoman Dina Titus and Montana Senator Jon Tester, they both have introduced legislation called the Nurse Act. And Congresswoman Titus's office, they sent a letter that says, quote, the Nurse Act would provide federal funding through Department of Education grants to hire school nurses, the first investment of its kind. Now, Congresswoman is also pushing for this bill to be in the upcoming budget reconciliation package. We'll see what happens there, Poppy, but of course, this is an ongoing issue, and school nurses I've talked to really hope that the pandemic can shed light on this and lead to change.
Yeah, of course. Jacqueline, thank you for the reporting very much. Let me bring in, to talk about all of these headlines, public health physician Dr. Chris Purnell, fellow at the American College of Preventive Medicine. Also, I should note, doctor, you participated in the Moderna vaccine trial after you lost your own father to COVID-19. We're glad to have you back. Thanks for your time.
Morning, Poppy.
Where is your head now this morning amid all of these headlines and the real unknown about when boosters might be coming, namely Moderna, which you were part of the initial trial?
Definitely. Where I want the public and the community to focus is that we need to rev up our game. And I use that sports analogy just to continue with the previous conversation. We need to rev up our game around getting unvaccinated persons vaccinated. Yes, boosters are important. Yes, the White House had a misstep in its communication by giving a specific date, but I don't want people to lose sight. The one way to end this pandemic, because we're in a whiplash. We started to see progress around May and June, and now daily cases are exploding. Hospitals are at their end. We need to get unvaccinated folks vaccinated, while then thinking about a rational strategy around boosters, especially for those most vulnerable and most at risk.
On top of all of this, we have, the havoc that Hurricane Ida wreaked on the Gulf Coast, on New Jersey, where your hospital is, on New York. What has the impact of that been for you guys?
Well, Ida did what, unfortunately, hurricanes do. Whenever there is any type of public health disaster, and hurricanes are public health disasters, you have flash flooding, you have tornadoes that touch down in New Jersey, and that put communities further on edge. I even have people in my family who were impacted by Ida. And so whenever you have vulnerable or marginalized groups, groups who are already at risk, groups that are already beleaguered by the pandemic, a public health disaster like that just worsens it.
When you think about the Biden White House right now, and I don't want to discount that we are seeing an increase in vaccinations. That's a good thing, right? Especially in states where we weren't seeing it before and that have these tragically high COVID rates and hospitalizations and deaths. But now a lot of the focus out of the White House and frankly a lot of the media attention is on boosters. So my question to you is, are you at all concerned that that's sort of speaking to the people that have already acknowledged the importance of vaccination rather than tackling those who are still hesitant to get an initial vaccine?
I am somewhat concerned, Poppy, if I can be just very forthcoming. I don't want us to lose sight of what the appropriate end game is. In this pandemic, there will be several finish lines, and we don't want to ever declare premature victory, or we don't ever want to get our eyes off of what is most essential. And what is most essential is ensuring that those who are unvaccinated get vaccinated. Look, if you're unvaccinated, your risk of hospitalization, your risk of death is not even comparable to if you are vaccinated. Boosters is about getting those most vulnerable with the most robust immune protection, and I'm in favor of that. But I just want to right size the urgency and right size the message.
Thank you very much, Dr. Purnell. As always, good to have you.
Thank you.